Motivational interviewing is a great tool to engage patients and evoke the changes you wish to see. But what does that look like in a real-world scenario? We're going to demonstrate that here so you can have a better understanding and feel more confident about using it in your practice. Hi, I'm Catherine Anderton. I'm the Clinical Product Analyst here at ThoroughCare. It can be a little daunting to figure out how to implement a new technique in your patient care. So right now we're going to demonstrate a scenario in how you can engage patients using motivational interviewing and what that conversation would really look like. If you'd like to learn more about motivational interviewing before diving into the scenario, then feel free to watch that video right up here. I'm going to be using 4 main strategies: affirmations, open-ended questions, reflective listening, and summary. The first being affirmations. This is when I'm acknowledging the strengths and encouraging the behavior that's conducive to change. It's important to note that change can be little or big, and we want to encourage it all. Next is open-ended questions. It's important to have open-ended questions because those are facilitating a broader conversation and steering away from those yes, no questions where you're not getting a lot of information. Then we have reflective listening. It's really helpful to close loop that communication so the patient knows that you're listening and you understand what's happening. Finally, summary. That's summarizing everything that happened and the plan moving forward to ensure everyone's on the same page. So let's get into it and discuss what that conversation would really look like. Thank you so much for verifying your information and making the time to talk with me today. It's important that we affirm all of the behavior changes we wish to see in the future, even if it's something little, like taking time to talk with me. As you discussed with Dr. Stewart, I have been assigned to you as your personal care manager to make sure you have everything you need in managing your health. This can range from providing simple education to coordinating appointments and everything in between. I see you're taking amlodipine for high blood pressure. What are some things you are doing or have done to manage your high blood pressure? It's important to ask open-ended questions to better understand what the patient's doing to manage their health and to continue the conversation.
I just take medication. I tried watching my diet, but I had a hard time sticking to it. I cook for my family too, and they just like everything I make, so we just end up going out to eat.
Changing your diet is a great step in managing your high blood pressure. Here I am affirming the changes I want to see. It can be hard changing your diet, especially when you're responsible for cooking for other people. This is reflective listening. It's important to listen to their concerns and let them know that you hear what they're saying.
Well, besides not watching what I eat, I think I have a lot of stress from taking care of my dad, and I know that can cause my blood pressure to go up.
I am so sorry that you are dealing with the stress of taking care of your dad. Taking on the role of a caregiver can be incredibly taxing. Difficulty following a cardiac diet and managing stress are definitely things that can make it challenging to control your blood pressure. Here I am again demonstrating reflective listening, letting them know that I'm hearing what they're saying. Now that I understand the barriers to controlling your high blood pressure, I would love to understand your motivation. Why is it important to you to control your high blood pressure? There's that open-ended question to keep the conversation going.
I know the doctor says I have to lower my blood pressure so I don't have a stroke. Personally, I guess I don't want my blood pressure to go up because I hate the thought of having a stroke and needing to live in a nursing home. I want to stay as independent as possible for as long as I can.
Keeping your blood pressure less than 140/90 is a great goal to have. It can reduce your risk of complications like having a stroke and help you stay as independent as possible, which is the perfect outcome. Following a heart-healthy diet and managing your stress are great steps to accomplish this. I would love to help you work on that. Before we discuss a plan, is there anything else you'd like to add or discuss? This is a great time to summarize the conversation to ensure we're both on the same page. It's a collaborative process, and this can help the patient feel like they're not isolated or alone in managing their health. They recognize that their care managers are there as support, and we're working alongside them to get them to where they need to be. If you'd like to learn more about motivational interviewing, feel free to click the link below, and also like and follow to see more content.